ADHD medication in bodybuilding, science, effects, and risks. Intro. Hi, and welcome to today's video. Today we're going to talk about a topic that is both controversial and almost never openly discussed in the bodybuilding world: the use of ADHD medications as performance enhancers. We'll go through why some bodybuilders use them, what effects they provide, the risks involved, the differences between various drugs, and why using them without a prescription is both medically risky and legally dangerous. So stick around, because we're going to dive really deep. What are ADHD medications? ADHD medications are central nervous system stimulants that increase activity in the brain's signaling systems. The most common ones in Sweden are methylphenidate, Concerta, Ritalin, and Medicanet, lisdexamfetamine, Elvance, Vyvanse, dexamfetamine, Attentin, and in some cases, modafinil, not a classic ADHD drug, but used for focus and wakefulness. They work by increasing dopamine, boosts reward sensation, motivation, and endurance. Increasing noradrenaline raises alertness, energy, and focus. Reducing impulsivity makes it easier to stick to a training plan and diet. Why some bodybuilders use ADHD medications. Although intended for treating ADHD, some bodybuilders use them as a kind of mental pre-workout, especially during contest prep. The most common reasons are increased focus in the gym, easier to maintain perfect form during heavy lifts, fewer distractions, more mental presence, appetite suppression during dieting. Stimulants reduce hunger, makes it easier to maintain an extreme calorie deficit. Energy during a calorie deficit. Contest prep often leaves the body tired. Stimulants mask fatigue. Fighting brain fog. Low-carb diets can cause mental fog. ADHD medication can counteract this. Mental discipline. Less risk of cheating on diet or skipping workouts. Differences between various medications. Methylphenidate, Concerta, Ritalin, blocks dopamine and norepinephrine reuptake, produces smoother mental clarity, less euphoria than amphetamine-based drugs. Lisdexamfetamine, Elvance, Vyvanse, a prodrug that converts to dexamfetamine in the body, provides longer, steadier effects, 8 to 12 hours, stronger appetite suppression than methylphenidate. Dexamfetamine, Attentin, more potent, shorter duration, greater risk of heart-related side effects and sleep problems. Modafinil, not classified as amphetamine-like, more wakefulness than an energy rush, lower addiction risk but still banned in competitive sports. Positive effects in a bodybuilding context. Increased training focus, more explosiveness in strength training, appetite suppression, useful during cutting, higher motivation while dieting, mental sharpness even with low carbs. Risks and side effects. Heart risks, high blood pressure and heart rate, risk of heart attack during intense training, sleep disturbances, poor sleep, worse recovery, less muscle growth. Psychological effects, anxiety, irritability, paranoia at high doses. Addiction, the brain can start to rely on the drug for performance. Crashes, when the effect wears off, you can feel completely drained. Dosage and timing, medical versus bodybuilding use. Medical dosage, methylphenidate, 18 to 72 milligrams per day. Lisdexamfetamine, 30 to 70 milligrams per day. In bodybuilding use, some take it only on heavy training days or during the final weeks of a prep. It often taken 30 to 60 minutes before training. Many avoid late-day doses to prevent sleep problems. Legal and anti-doping risks. In Sweden, these drugs are prescription only and classified as narcotics. Using without a prescription is illegal. In competitive sports, they are banned substances and will result in disqualification if detected. Conclusion: ADHD medications can absolutely provide certain benefits in bodybuilding, especially in terms of focus, appetite control, and mental discipline. But they come with a heavy price: risks to the heart, sleep, mental health, and the potential for addiction. For most people, it's far better to work on diet, sleep, caffeine, and training technique rather than venturing into stimulant medication without a medical reason.